Good afternoon and welcome to the Network Live. We're back. Fridays is the it's been y'all, it's been a long week, long week. And so we are sorry that we're delayed today, but we kind of had to come together and talk about all the stuff that we're all working on. And Dr. Mac had to get his COVID stats together. And so we are ready finally. Sorry about the CP time. But anyway, Dr. Mack is here today, and thank you for being here.
Great, thank you. I appreciate you as always. Good to see. Good to be in the house with good company.
Absolutely.
Yeah.
Exactly. And then, of course, Marilyn Hemingway, President and CEO of the Gullah Geechee Chamber of Commerce. Thank you so much for joining us again this Friday.
Always a pleasure to be here.
Absolutely.
Glad to be with you.
Yeah. So again, a lot is going on, especially moving into the weekend. There are a number of peaceful protest events that are happening, and of course, all of that is very relevant to COVID-19 when it comes down to updates and things that you all need to know to just make sure that you protect yourselves and you're safe while you're out doing the peaceful demonstration thing. And so, Dr. Mack is going to get right into some numbers. Tell what's the picture look like? What's going on, Dr. Mack?
Well, in the last week, worldwide, the number of cases have gone from 5.8 million up to 6.8 million worldwide cases.
What?
The number of deaths in the last week worldwide has gone from 365,000 to 396,000 worldwide. In the United States, the number of cases have gone from 1.7 million to 1.9 million. And the number of deaths in the U.S. in the last week has gone from 104,000 to 112,000. Now, specifically in South Carolina, in the last week, the number of cases have gone from a little under 11,000 to a little over 13,000 cases. The number of deaths in South Carolina in the last week has gone from 470 up to 525. Horry County in the last week, the number of cases have gone from 395 to 506. And the number of deaths in Horry County have gone from 24 to 28. In Georgetown, and I'm going to say this, in the last 2 weeks, the cases have gone from 54 to 79. Deaths are 4. Marion County has gone from 67 to 74 cases with 5 deaths. Now, this data is as of this morning. Today's data has not been released yet. Typically, they've been releasing today's data, usually anywhere between 5 to 7 p.m. So those numbers will be higher once they're released shortly. So and I want to say this. I got some information from DHEC, and as of this past Monday, there were a little over 11,000 tests done in Horry County. And out of those tests that were done, 4.2% of the people that were tested were positive. So, the thing is that in the last 3 weeks, we've had a lot of activity on the Grand Strand. The week before Memorial Day, we had a lot of people come. Memorial Day, we had a lot of people come. And then we've had several marches that took place this past weekend. And we'll get into this in just a little bit. I know today's show is abbreviated because we're just kind of talking about some specific stuff today. But the thing that I'm most concerned about is making sure that people that are a part of these marches or gatherings, to make sure that you're wearing masks if you're going to be in groups. It's going to be very, very, very important to wear these masks. We know certainly when you're in the midst of a gathering where people are talking loud, people are singing, people are, doing those kind of things, these particles are going to go farther and they're going to go faster. And so there's a possibility that there will be more of a spread. There's a concern that some of these gatherings will create super spreading events to keep this virus continuing to perpetuate itself. One thing I did want to say is, and I want to give this story. It's a true story, and it's happened March the 10th in a little town called Mount Vernon, Washington. 61 people met for about 2.5 hours at a church. They were at a choir. They were at choir practice. They sang, they ate, and they did more singing. But one of those people in that group of 61 had been feeling ill for about 3 days. They thought that they just had a cold, but it turned out that that person was COVID positive. In the next several weeks, 53 of those 61 people got sick. 3 were hospitalized and 2 died. This is a prime example of a super spreading event associated with COVID-19. It doesn't take but one person to affect 1 or 2 or 3 others. They go and affect 1 or 2 or 3 others, and then they go and affect 1 or 2 or 3 others. It's almost like branches of a tree. This is what's happening in these nursing homes. This is what's happening in these meatpacking plants. This is happening in these ski resorts, these churches, these restaurants, these hospitals, and these prisons. So please, I'm asking, please wear these masks. I know there's not going to be a whole lot of social distancing that can really take place during a march or a gathering, but you got to wear something to cover your mouth and cover your nose. Because if you don't, you run the risk of getting infected, infecting others, and taking it to other people that you love and care about. Okay.
Yeah, this is so true. I mean, I don't think that we can push the message enough, and we've been pushing it certainly for the past few months. And now that there's a new dynamic with the demonstrations and gatherings, it's now important, now more than ever, that people just remain vigilant. And as we said before, coronavirus is still alive and well, even though there are some people who believe to the contrary. It's still alive and well. Right. And I think it's also important that anyone who's organizing any demonstrations and events, that they actually communicate to event goers, demonstrators, that they definitely need to protect themselves. So I know Marilyn is going to share with us the event that is happening in Georgetown and what they are doing and how they're promoting that type of safety. And so if you're even thinking about organizing an event, take note, because these are precautions that can help save lives and definitely mitigate the spread because of this type of activity. So Marilyn, talk a little bit about what's going on in Georgetown, and then I'll give updates on Warwick County.
Very good. So thank you, April. So tomorrow, Georgetown, we are hosting a March for Justice, and we are emphasizing social distancing and wearing face masks. What we're actually going to be distributing face masks because Thailand's Health has stepped up, and they will be out there with the face mask and tables to distribute to the participants. So the March for Justice is taking place tomorrow in Georgetown. We are gathering at Wynyard Auditorium in East Bay Park at 10:30 a.m. You will be directed to where the march is starting, and the march we're going to start at 11 a.m. And we'll get going, and we're going to go down Front Street, and we're ending up where we're going to end with a rally. And the youth and young adults of Georgetown, and I can say that because I'm no longer youth, and
You're as young as you feel.
I am. I'm young. That's how I've been struggling with that term all week because I'm like, I'm young. I mean, it's really, I've got to get it in my head. But
I'm young.
yeah, teenagers, 20s, and 30 somethings have really come together. All right, and planned this event. It is multi-generational. It's family oriented, but it is definitely a march with a purpose and a message. If you're you're going to be offended by what you think people not exercising their freedom of speech, this may not be for you. But it is going to be a peaceful solidarity march with the George Floyd family and the families of the others who have recently been murdered, um, unfortunately, by certain folks in law enforcement. And people, they're marching to address systemic racism and oppression. And I'm very proud to be working with this group that has come together in the last week and worked with the law enforcement to make this happen. The city of Georgetown police chief is on board. The entire department's on board, and Sheriff Carter Weaver with the sheriff's department, they are on board also. And one thing I want folks to remember is this is actually long term. They already have plans to meet with law enforcement in the future and come up. They've already come up with some things they want to see change, systemic change in Georgetown, in the spirit of solidarity with what's going on in this country. And in that spirit, we're telling people don't come if you don't plan on wearing a face mask. Do not come. If you have your own, please bring it with you. We do have face masks available, but once we run out, we run out. So this is a serious thing, folks. If you're not going to think of others, and that's the whole point of this. Um, People have not been thinking of others, and we don't want to set that example any further. So bring your face mask. If you do plan on marching with us, we will have face masks available. And I know, don't. I think we're gonna have most people covered between the
Mm-hmm.
hospital and other people donating. I think we're gonna have most people covered. Um, just bring a handkerchief. What's it, a bandana and stuff. If it comes down to that, bring something. Plan
Cover,
on
yeah.
covering your face. Yeah,
Mm-hmm.
and water will be provided, and transportation between spots. Churches have also stepped up with vans. So we've tried to think of everything to keep people safe and do that social distancing. We're just asking the people to come on out and work with us. And I agree, we see what's happening. I personally, in listening to Dr. Mack and just listening to all these people on the different shows, I knew the numbers were going to rise once the states start opening. And so we need to do our part during this time of civil discourse to,
Mm-hmm.
to to not add to that, to not add to those numbers. So, and that's where we are.
Yeah.
And I encourage anyone protesting anywhere, wear your face mask, practice social distancing as much as you can during a protest, and just be smart. Just be
Right,
smart about this, and we'll all get through it together with
right.
some
Mm-hmm.
serious changes that need to happen.
And I'm glad
We
you
know
said
change need to happen.
I'm
Hmm.
glad you said that, Marilyn, because hydration is so important. It's supposed to be
Hmm.
pretty humid tomorrow. I think
Mm.
it's going to be, a chance of rain tomorrow, but it's
Yes.
still going to be pretty humid tomorrow.
Yeah.
Upwards of 90 degrees with the temperature,
Wow.
with humidity feeling like it's probably going
Yeah.
to be in the mid 90s. So
Yeah.
if you're going to go out and march and participate, it wouldn't be a bad idea to start hydrating pretty good tonight, this afternoon, tonight, and in the morning, and make sure you're getting water throughout the day tomorrow. That's going to
Yeah,
be
I'm
very.
glad you mentioned that. I mean, honestly, there's gonna be a lot of water out there because that's everybody's thinking about water. It's a 44% chance of rain in the afternoon. That's why we're doing
Hmm.
it as early as possible in the morning to do the march, do the rally, clean everything up. Once a Girl Scout, always a Girl Scout, and we're about cleaning up. And I'm a Girl Scout, and getting out there. We don't want anyone to come out there with bad intentions, but we want to take care of everybody too. So there's gonna be lots of water out there.
The other
Hmm.
thing I'd like to say too is that if you all can, if the people that are coming out, if they can have hand sanitizer. Again,
Mm.
hand
Hmm.
sanitizer needs to have at least 60% alcohol in it. If it's less than 60%, it's not going to do anything against this virus. So it needs to be at least 60% hand sanitizer or alcohol in the hand sanitizer.
Alcohol in it.
The other
I
thing,
definitely will bring that up in our meeting tonight
right.
too.
The other
Hmm.
thing too is there's this big thing about wearing gloves. Okay. And I have to say this, it's okay to wear gloves if you're changing the gloves periodically. But the same person wearing the same pair of gloves all day long, you're just taking bacteria and viruses from one place to another.
Mm-hmm.
So it's
Mm-hmm.
important to make sure if you're wearing these gloves that you change them out, you rotate them out. Because when people are wearing gloves, they tend to be a little bit more free with what they're touching. But if
Mm-hmm.
you have
Mm-hmm.
bacteria on your hands, you're just moving it from one place to the other. If you went and pumped gas with those gloves on before you went to the march, and you got the same pair of gloves on at the march,
Yeah.
you just took the bacteria or viruses from the pump and took it to the march.
Mm-hmm. Mm-hmm. Absolutely. What time did you say the march and rally starts?
10:30 we are gathering at East Bay Park or Winyard Auditorium, and
Uh-huh.
from there you will be directed to where to go for the beginning of the march because we've had to adjust unfortunately for a funeral. And we are planning to start the march at 11 a.m.
Starts at
If you
11
come there
a.m.
early, that's fine because we're going to be out there 9:30 in the morning. So if you come at 10, that's fine. But 10:30 definitely, and 11 o'clock the march will start.
And what's going to be the duration of the march and rally? What time probably
Um,
wrap up?
about I'm going to say 3 hours max,
Mm-hmm.
and that would include getting everybody into place. Getting the march done, going down there. We expecting uh I'm going to say more than 200 people.
Mm-hmm. Okay. All right. So
And we
roughly.
welcome that. You can come on because they're actually
Mm-hmm.
blocking off the streets. That's why law enforcement is working with us. They are blocking off the streets, so we're going to be in the streets so we can get the people. So if you just come on down, so that'll give us more space to spread out.
Mm-hmm.
Georgetown, we're blessed in the historic district to have broad streets, so
Mm-hmm.
that will help us with that social distancing. So if folks are afraid of that, just come on down. Just make sure we, as Dr. McIver said, hand sanitizer. I'll tell the group tonight. I'm sure we can all dig some stuff up. I actually bought some more this week, so that's helpful. Definitely the face mask and staying hydrated.
Okay, so peaceful solidarity march and rally at Georgetown, South Carolina, from 11 to 2, roughly 2 p.m. tomorrow. East Bay Park at Winyard Auditorium. Sounds like it's going to be a nice event, and commend you and the other organizers, for putting together an event so quickly. Organization is the key, and unity is the key to all of this as well. So I'm glad that you
Yeah.
were able to have so many entities working with you to make it happen, Marilyn.
I have to say this, and I say this because it actually addresses what we're facing. It has not been easy, folks. Change is not easy, and there were a number of entities and just coming together in this, and everyone had a vision, and so it was not easy bringing all those visions together. And there's some disappointment, and there's some people who are not so disappointed. But I had to tell them, guess what? Systemic change is hard.
Mm-hmm.
And if we can't come together to do this, how do you expect to make that change moving forward? Because it's not going to get easier; it's going to get harder.
Mm-hmm.
That's why we are in the situation we are in now with our country because no one listened, and it did come a few times. We had to back up, and I had to tell folks just take a deep breath because we weren't listening to each other. And I said, "Isn't this why we're doing this? Because
Mm-hmm.
people have not been listening to each other, and if we can't listen in this small group,
Mm-hmm.
what do you expect to do when we walk out this door?" And they got it. They got it. I've seen the growth in the last week of some folks, and I'm very proud of them. And we're setting in Georgetown, setting the example in this. And this is a diverse effort, a multi generational effort,
I was
and
going to
I'm
say
looking.
you're working with a lot
Yeah,
of young people on this, right? You're actually kind of
very.
guiding through.
Yeah,
Yeah.
yeah. one
Yeah.
reason I did. One reason I did not become a teacher. I know. Woo. I mean,
Yeah.
I love my people, but it was interesting. It's been interesting. Let's put it that way.
I'm
But
sure.
it's gonna be well worth it. But we did have that discussion that we've got to communicate here. So the systemic change that we're going to continue fighting for, it's going to get harder because everybody has not been for this. That includes elected officials. We know that. I know that we've had to have some interesting conversations during this, and this is just the beginning. And that's what I really admire about these young folks is they said that we don't want this to be a one-off event. That is also part of the problem. We do one event, but we don't continue the message, we don't continue the change, and they've already planted the seeds to make sure that this continues. Law enforcement is on board. They're ready to sit down with these young folks. So don't think of this as a march that's culminating something. Think of this as a march that's introducing something. And I'm very proud of these folks. But it's been an interesting journey this past week. I'm
Yeah,
exhausted.
I'm sure. Yeah, I'm sure you are, and I think that's another reason why I feel like I'm kind of in a fog right now. Just that same conversation that we had with some young people last evening. We did a special network live and talked to some organizers for events that are happening in Horry County, and I think that the same themes you're talking about resonated in what we were discussing with these young people. What I'm hearing from you is that there's not a duplication of efforts. Everybody came together to make it happen. And I think that that's really where you set the example, especially in our community, that, it's okay to bring brilliant minds together who are thinking alike. Like they say, great minds think alike. And everybody has their own set of strengths that they can bring to the table. And there's definitely strength in numbers. So if you can, come together and make it happen like that, then I think it's awesome. Kudos to all of you, and good luck. God bless, as far as everything tomorrow. Dr. McIver is kind of giving us his marching orders as far as what we need to do.
Yes.
To make sure that everything is everything. And, hopefully everybody will abide by those rules and remain safe the entire time.
Very good. Well, I'm gonna have to dip out on you guys because the phone is blowing up and everything. It's always a pleasure. I'll see you next week. I might be a little tired, but I'll be there.
Okay, all right. Well, we'll see you next week. We'll come up with something.
We need you to be there. We know where you live.
That's the truth.
That's right.
That's the truth now.
Awesome.
All right, y'all. I'll see you later.
All right.
Thank you so much. And I just want to acknowledge some of our viewers today. Thank you for tuning in. Dr. McIver and I are going to be very brief today, and we just he's given some COVID-19 updates. And for those of you who are just tuning in, we may have him just kind of go back over them a little bit before we actually leave the broadcast. But thank you so much to Terry Dow McLean. Your support is so highly appreciated. Every blessing is definitely something that we hold close to us. So thank you so very much. Tanya DeWitt Green, thank you for tuning in. Tanya Jones, every single week you're here. We do appreciate that. And I also want to send special shout out to JD Spain Sr., all the way from the Northern Virginia area, and for definitely supporting this broadcast. JD Spain is a homeboy. And, even from Northern Virginia, he is, definitely tuning in and paying attention to what's going on back home. And that's important too, because you never know where change, can actually happen. And, we're working on things down here, but there might be something in his network up in the Arlington area that, we can use as far as resources. So always stay connected to home. And JD, thank you so much for your support. He is the owner of Gen X Strategies and Consulting LLC in Arlington, Virginia. It's a veteran-owned business specializing in public and civic affairs, and also retired military. So thank you again for tuning in. Paige Connolly Watson out of the Greenville area. Thank you so much, Paige, for tuning in. We appreciate you too, classmate. And of course, Denise Chapman. We know that you're doing big things in Georgetown, so thank you so much. No, you haven't missed it. You might have missed Marilyn, but we're still here for just a few minutes. And of course, we always have the rebroadcast on our pages so that you can see the information that Dr. McIver gives us every single week about the updates on the coronavirus. So as Marilyn mentioned, there's a peaceful solidarity march and rally in Georgetown tomorrow morning, gathering at 10:30 a.m. East Bay Park and Winyah Auditorium. Rally starts at 11 a.m. to 2 p.m. And flipping over to Horry County, there's several things going on in the Conway area and also in Myrtle Beach. So from 10 to 12 p.m., there's going to be a voter registration drive at the Horry County Courthouse. And so, of course, if you need to register to vote or, you want to, let somebody know that the voter registration is going to be available. Send people out, get them registered, preparing everybody for the November 3rd elections. Of course, it's too late to register to vote for any of the June 9th primaries, but November 3rd, we still have time to get ready. Hi, Andre Bellamy. Thank you for tuning in. And then right after that voter registration drive is over, there's a rally at the courthouse that begins at 12 noon, and that rally will run until 3 p.m. The primary organizer for that event is Miss Unique Burrows, and she's the organizer of the event that took place last Sunday. Her focus is going to be all about voter registration and voting as well, and she's going to, talk also about what we need to do to make sure that our vigilance is consistent when it comes down to even the recent tragedies that have happened. But the primary focus is going to be bringing everyone together to hear these messages about how that systemic change can happen. And it does start with voting. So if you want to support Unique and the rally at the courthouse, it begins at 12 noon. And she's going to wind up everything at around 3 p.m. She is speaking. And that should be a great event. There's also a march. They're going to do a short march up the main avenues in Conway and back down to the courthouse. So again, as Dr. Mack said, get hydrated starting now. Put on some good walking shoes. I don't know if we mentioned that. Put on some good walking shoes, your mask and everything that you need. And you may even want to take your umbrellas just in case that 44% chance of rain kicks in. Then there is a justice rally that is going to take place in Conway as well that starts at 12 noon. And I believe that rally runs until about 5 p.m. And it's off of 378 near Whittemore Park Middle School. So that particular event is organized by Yvonne Sherman. And she has a number of guest speakers who will be assisting her with the program. There will be some speakers, which include Cedric Blaine Spain, Ulysses Sherman, Reverend Miller from Bethel AME Church in Conway, and a host of other people who will speak on the issues that she's trying to shed some light on. So if you are interested in participating in that particular event, again, it's the Justice Rally. It's going to be at a site near Whittemore Park Middle School. I'm sure as you're approaching Whittemore Park, you can't miss it. There's a little area that's right before the school. It's like a field area that where everyone is gathering, and that event will happen from 12 to 5 p.m. tomorrow. I will post these dates and times for the events tomorrow on my Facebook pages so that all of you can take note and take part if you wish. On Sunday, there is a Protest for Peace. I think it's called Protest for Peace. That's going to happen at Market Common. And of course, Market Common is the site of the old Air Force Base in Myrtle Beach. And it's now a work, live, play development where there's a peaceful demonstration that's happening there. And again, those organizers were with us last evening to talk about everything that they have planned as well. That event kicks off at 2 p.m. And I believe that one is from 2 to 6 p.m. So if you're interested in attending that event, it's actually happening on Sunday. And if you have any questions for any of the event organizers, you can actually leave me a comment or inbox me on Facebook, and I'll be more than happy to get some information to them or questions that you may have to them about these events. So Dr. Mack, there's a lot going on.
Yeah, there is. There is. And I know we talked to some of these people last night who were organizing, and again, the same information that I gave to them is the same information that I'm giving here today. Hydrate, 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 protect yourselves, protect the community, wear these masks or some type of face covering, and just be mindful that, super spreading events can happen and can cause this to go on. And perpetuate itself. Again, one thing that I do want to kind of focus on a little bit more as we continue to talk weekly, is the number of people that have recovered. Okay, because if we do this thing right, we can definitely get, a faster recovery rate. It typically, historically, taking pandemics anywhere between 18 to 36 months to get fully contained. The Spanish flu was a biggie, and it took about 2 years, but most of the time, you know, anywhere between 18 to 36 months. But worldwide, it's estimated there's been about 3.3 million people that have recovered. In the United States, about 715,000 people that have recovered. In South Carolina, a little under 7,000 people that have recovered. So again, this is important stuff. It can be done, but people just have to be vigilant because the virus didn't go anywhere. I mean, you know, it's like we went from one day from this to one day from that, and just it makes healthcare providers, physicians, people that understand and study epidemiology to just kind of cringe when you see all these people gathering in large gatherings without any kind of protection, any kind of mask on. I mean, and so really, it's one of those things where we just have to be vigilant about. I encourage every one of these organizers of these marches to make sure that they encourage wearing masks. There actually is a march that's going on next weekend in Columbia. Where, the men are supposed to dress up in their Sunday best and not only look good, but look good, march for a purpose. And I talked to the organizer in Columbia about that to make sure that he understands that masks need to be provided. He was so thankful that I called him. We talked about masks, we talked about hand sanitizers, and the young man was very respectful. He reached back out to me, and I explained to him who I was, what I do, and my concern. And he was very well received it very well. And we can march for a purpose, and we can look good doing it. And I think that's a unique take on it. But again, protection, community protection, participation protection, participants protection, all that's important. All that's important, and not be forgotten in whatever's being done, because that's important.
Exactly. I know you mentioned the march, and you're talking about the march in Columbia, and I just want to be specific about it, and the fact that this is particularly geared towards changing the perceptions of Black men. So it's a march of Black men who have chosen to dress up in professional attire, just like Dr. Mack today, to pretty much send the message that, you know, any stereotypes or typecasting of Black men should definitely be dismissed, because it's important for people to understand that, especially in terms of what we're dealing with the racial tensions and this crisis that we have in America. And so, you know, understanding that all of these demonstrations are taking place, they're all for a common purpose, even though they're different aspects or different concepts that underpin the intentions behind the demonstrations. And it's okay to do that because there's so many issues that we have to conquer. There's so many issues that need to be addressed, and there's a level of understanding that needs to be developed between people. You know, the problem is that we don't communicate enough. And if you misunderstand me, it's probably because you've never had a conversation with me. You've never, you know, attempted to get to know me. Same thing on the other side of the table. And so, you know, we have a very unique position now as resources for people to help get those messages out. And you got to imagine what the protest or demonstration organizers are probably going through to figure out, well, how can I, you know, be intentional about my message and purposeful about my message, and everybody understand where I'm coming from. So it's interesting to note too that, you know, a lot of what we've talked about today in terms of the 3 or 4 marches that are happening are all spearheaded by young people who are anywhere from 19 to, like Marilyn says, and they're probably 40 or younger. And it's interesting that there's an awakening with that particular, within that particular age range or those populations. And so we're going to see this more and more, hopefully, at least that's the hope and the prayer, that it will move beyond the moments, as Amanda Butler, who was helping me to moderate the program last night, said it will move beyond the moments and into movements to tackle legislation and policies and things that are embedded in our systems so that the systemic racism can be diminished. Thank you, Gloria Wilson, for joining us today. She says it's your first time attending. Hopefully it won't be your last. We certainly appreciate her. We love Gloria Wilson, don't we?
Aunt Gloria. Aunt Gloria.
Yes, we love Gloria. And she brings up a great question, why 2 marches? I think that, at the height of everything, everybody just wants to do something. And everybody jumps out there with an idea that or a vision that they have for creating these platforms. But what we've learned, Dr. Mack and I have had some pretty extensive conversations about this, and I've talked with other people, again, it goes back to strength in numbers, but also, that unified front and doing things collectively, which is what a lot of communities need to learn how to do. We have to put aside our personal aspirations and personal agendas and bring our strengths to the table and unite in order to make sure that everybody's on the same page and that we're not duplicating efforts and we're not stretching ourselves too thin. So maybe, over the course of this week, which is from last week to this week, a lot of marches and demonstrations have happened. Hopefully, even the organizers of the protests that are going to occur this weekend and the ones from the past weekend, hopefully they'll get together and they'll talk about the good things, the bad things, how they can collaborate. I like what Marilyn was talking about as far as even collaboration with those entities that really matter. We have to collaborate with law enforcement no matter how we feel about them right now, whether that's good or bad. We can't generalize and say, we don't want to work with them because, the bottom line is that we need each other. And so for safety reasons, there has to be that collaboration with law enforcement. So now's the time to develop and establish those relationships with law enforcement if you don't have them already. And, even from a standpoint of resources, they've collaborated with Tylen's Hospital to make sure that there's masks and water and, probably medical care should someone need it. And that's really important too. So those are the little details that people don't really think about when it comes down to organizing huge events. But as we move forward, anyone who's listening, who's even remotely thinking about pulling together a demonstration or a protest, should be taking notes at this point and figuring out how they can actually bring their strengths to the table and also how we can unify people. And I would love to see even something that's, countywide or across counties, because, it would have been great to, have a great event in Horry County. And then after that, everybody could have gone to a great event in Georgetown. If it's coordinated, if the strategy is right, those kinds of things can happen. And it's not to say that we can't do it. We just have to be intentional about making sure that we unify to and create that togetherness and show that the communities want to come together to work together. So, Dr. Mack, is there anything else? I know there were some people who kind of came in late and you gave us some stats in the beginning, at least maybe restating at least, South Carolina, Horry County numbers. I know, one of our loyal viewers, she mentioned that even in Loris, there were 10 deaths since Tuesday.
Right. Yeah.
Stuff is still happening, y'all.
Yeah. They're having the nursing home in Loris and the nursing home in Tabor City that have been identified as some hot spots for deaths, cases, and 10 this week. And so it's in Loris. So it's been, concerns there. I'm sure they're doing everything they can to try to help combat it in those facilities. But again, those people in the nursing homes aren't going anywhere. It's got to be somebody coming into the facility. So again, that's a concern. That's a captive audience. Not to mention, I do want to mention these 2 studies that just came out. One about the diabetics and one about the cancer patients. I know I mentioned it just a little bit last week, but it bears repeating. Study that was done, 53 different hospitals. Patients from 53 different hospitals were evaluated. All the people in this study had diabetes. In the first 7 days of hospitalization, 10% of those diabetics died. In the first 7 days, 10% died. 20% were on a ventilator. Only 18% of those diabetics were discharged after 1 week. People that had sleep apnea and diabetes were 3 times more likely to die within the first week. People that were over 75 with diabetes and COVID were 14 times more likely to die in the first week than somebody under 50. These are staggering numbers. Now, I can't say that they're surprising because people, physicians really felt that those numbers were probably somewhere close to that, but it was confirmed by a test that was by a study that looked at 53 different hospitals. Another preliminary test that was resulted was show that patients with increasing age over the age of 65 who had cancer currently or had a previous history of cancer had a significantly higher chance of dying than those in the same age bracket who didn't have cancer. So we do know that patients who had cancer, who are currently being treated for cancer, or who had a history of cancer in the past, have a higher risk of dying in regards to complications from COVID-19. It basically is a multi-organ condition. We know that it can cause strokes, heart attack, associated with strokes, heart attacks, kidney failure, blood clotting conditions, rashes. And so it's just a number of things that can be associated with COVID, the spread of COVID, and just being proactive about taking care of yourself and helping try to take care of others is the order of the day. Mm-hmm. I know one of the big things now is that the South Carolina High School League just announced that they're making preparations to start sports back. And they're going to do, as most people, this phased approach, phase 1, phase 2, and phase 3, mm-hmm. which is important to follow those guidelines. I've had some parents call me and ask me, should I let my kid play football this year? And that's a good question. I mean, again, I think the schools, the high school league has done the best they can do to try to help be, proactive about it. Just like, me and my team at Coastal doing the best that we could do to try to bring these athletes back safely. We will have athletes coming back on Monday. Tidelands has stepped up again, I've got a very good relationship with Tidelands Hospital. They're gonna do the testing for us. They have an agreement with the state and DHEC where they have lots of tests, and they're the one that's kind of spearheading in the area doing most of these tests. So I want to give them a huge shout out for the help that they've given me in helping organize this stuff over at Coastal. I also want to give a shout out to Brother Gary Lee, my young brother, who has helped organize a number of different pop-up places to get testing as well. So I did want to acknowledge him, acknowledge Tidelands for what they've been doing. The thing about it is that these tests are very costly to get. I mean, about 2-3 months ago, I looked at trying to get tests, and just, for all openness, the distributors that I was looking at trying to get these tests from were going to charge me $13,000 for 500 tests. And so
Dr. Mack, are the tests free for
these tests are coming from DHEC. So DHEC has identified certain places that they will give these tests to. Okay. So we're talking about the viral PCR test, the nose swab, and some of them now you can actually even do them orally. But that's the viral test, the PCR test to tell if you got viral particles. The test that I was talking about was that I had an opportunity to get. And that was even before the FDA kicked out the 29 tests that they felt were inaccurate. So that was the other issue we were dealing with, is some of these tests were deemed to be not reliable, having as much as 50% error. So I had a dilemma as to whether or not to buy these tests, which could be upwards of 50% inaccurate and costing me $13,000 to get 500 tests. Mm-hmm. And I just, I'm like, well, first of all, I couldn't do it for various reasons. But number one, first and foremost, was I just wouldn't be assured that the test was going to be as sensitive and specific as it needed to be. Because again, when we're talking about these tests, we have to make sure that there's something that's not called cross-reactivity. In other words, COVID-19 is a type of coronavirus. Some of these tests will actually pick up any coronavirus, including the common cold. So you have to make sure that it's sensitive and specific to COVID-19. And that's what a lot of these problems with these antibody tests and these other tests we're having was the sensitivity and the specificity specific for COVID-19 that was a high number to be able to give the person the most accurate information. Well, once those tests became available, the states got a hold of them. The states partnered up with certain hospital systems, and that's how Tyler's is able to do a lot of these tests that they're doing, which I thank them for. And like I said, I have a great relationship with them and what they've been able to help do for the area and for the athletic department.
I think we mentioned before, the definitions and whether or not these tests are appropriate for symptomatic or asymptomatic clients. So what we're seeing in terms of the free tests that are being advertised now, are they for anybody or?
They're for anybody. And the reason, I mean, it's most appropriate for a person who does have symptoms. However, the reason why a lot of people who were even going to the hospitals early on and wasn't getting tested was because there was a shortage of tests, and a lot of these hospitals didn't know when they were going to get more tests. So they were actually testing the people who they thought that probably were sick enough that needed to be hospitalized. Mm-hmm. Whereas some of these people who may have been presumed to have COVID, but wasn't sick enough to be hospitalized, they were telling them to go home and quarantine. So that was the issue back then, was a supply and demand issue, mm-hmm. where there was a big demand for these tests, but the supply wasn't there. Well, the mm-hmm. supply is better now. And so we're fortunate that Tidelands in the area has that relationship, that have had tests, and they're the ones that's leading the pack with getting all these testing sites done, which I think they did a big one at the Pelican Stadium last week. I think they had over 1,000 people, and then they've got probably 7 or 8 more that they've got set up in the next month.
Okay. And I think too, it's would be helpful for people to understand that there was an article that came out, and it developed a little bit of dialogue on social media. And I think that the headline was that there were 19,000 new cases in the U.S. And so there were a couple of people who said, "Well, I don't believe that number. I don't think that. I think that number is inflated, or it's probably not a correct number, especially since day one, that kind of thing." And my response to that was, well, this is 19,000 cases in the U.S. And remember, we didn't have the testing in the beginning. And so, wanted to clarify for a couple of people that there were not 19,000 new cases in Horry County. It was a United States statistic, but also that now that we have more testing, we're probably going to see an increase in the cases, exactly. So it's relative.
Exactly. So certainly I believe that 19,000, certainly. Why not? I mean, it coincides with the country, quote unquote, opening up. Mm-hmm. I mean, that's not far-fetched at all. And actually, to tell you the truth, that's probably an under low. Mm-hmm. Probably a low number. Mm-hmm. So certainly this is still something that is important. It's something that needs to be taken seriously. Again, I always say facts, not fear. Certainly, I say there should be a healthy respect for this. Certainly, we don't know what the next 3 or 4 months will hold. Most pandemics have had a second phase for different reasons. The primary thought is that the second phase is because people got lax with what they were doing. Mm-hmm. Certainly, we know 8% of people that get this are going to recover. We know that. We know that. That's what studies have shown. That 98%, 97% of people are going to recover. But you're talking about numbers that are looking like probably 130 to 150,000 people that will die. That's a small mm-hmm. city. Mm-hmm. That's a city. Mm-hmm. That's a city that's strong. And so again, there are lots of reasons why that number is where it is. There are lots of things that should have been done to reduce those numbers. But again, right now, just trying to control as much as we can, educate as much as we can is so important.
Mm-hmm. I was trying to find an article that I saw just a few hours ago, and it was talking about how the South Carolina Department of Health uh, just recently released some information stating that there is an increase in the cases in South Carolina, and it's probably due to the reopenings because people are now gathering, businesses are opening, there's graduation ceremonies, of course, now there are demonstrations. And so, people have to be mindful about those things and, not dismiss any
Right.
information that's, coming as a result. And I think that the more we know, then the better we can govern ourselves as far as making sure that we stay protected, and don't feel awkward about the fact that you may be the only one wearing a mask when you go out, whether it's pickup or dine in or whatever it is you're doing.
Right.
You're doing what you need to do so that
Right.
because these cases are increasing.
Right. It is. And again, I just can't say enough. I mean, I've talked to colleagues of mine throughout the country, and I try to keep in touch with ones that are in hot spots. Some of my very good friends are in New Orleans, and they're calling me. I'm calling them, and we're just kind of talking about this stuff because, again, it's affecting our community. I mean, you've got some places where 80% of the people that are hospitalized are people of color with COVID.
Mm-hmm. Mm-hmm.
And so, the concern is that, thank goodness we hadn't seen the upswing in these multi-organ condition in kids. We haven't really seen as much of that lately. So thank God that appears to be at a pretty much decline or standstill. But again, I've been blessed and fortunate to be able to, keep a lot and maintain a lot of relationships from Morehouse and from Harry and in residency with people all over the country. And we do talk quite regularly. And, a lot of them are now calling me because they may be involved in some way with athletics and asking me my opinion and my advice on how they can help their college.
Mm-hmm.
One of my good friends is a team doctor at a small college in Louisiana, in New Orleans, and they don't have football, but they do have other sports. So he's trying to say, okay, Mac, what are you all doing? What are you doing, Mac? What are you saying? What kind of protocols are you writing? Because even though I don't have to deal with football early
Mm-hmm.
on, I got other sports that's coming after that. So I need to see what you're doing, Mac. What are you doing?
Right.
So it's important that we've got a good network of people that we talk to quite frequently. Most of my brothers from college. So it's big, and again, it's important, and it's important to spread this information.
Doc, there's thank you, Tim McCrae, for viewing us today. There's a question in the comments about pH levels, and because I know a lot of people think that if you do certain things health-wise, taking vitamins, eating right, or whatever, it helps to fight off COVID. And his question is, if your pH is high, like a 9.5, will it fight off COVID? Do you have any studies that suggest?
I don't know of any studies that have said that one way or the other. I have my thoughts on it, but as a physician, I can only talk about evidence-based medicine. So, in other words, if it's not a study that can back up what I think, I typically don't say it because that's the oath that we took as physicians, that only talk about evidence-based medicine. Again, certainly. It's been talked about the alkaline, type foods, the alkaline water, alkalinizing your water and things like that being more effective to help your immune system with a higher pH. pH, above 5 or 6 is considered higher. pH below 5 is considered more acidic. pH above that is more basic. So a lot of times these alkaline foods, that kind of gets back to Dr. Sebi's type thought, and others, not just him, but others, that alkalinizing what you eat and what you drink is more helpful to the immune system. I do believe there's some truth to that. Again, studies have to verify that before I can really advocate that it has to be grade A evidence-based medicine.
All right. Well, we said we were going to be, we said we were going to be brief today, and we've actually run about an hour or so, but I think it was a great discussion, and we've got
No
some
more
good
questions,
information.
no more questions.
Yeah. Are there any other questions from our viewers? Doc is willing to answer any questions you have that are COVID related, coronavirus related, anything that you need to know as you move into the weekend. And if so, just post below and we'll take a look at it. But as always, it's a pleasure to do this with you, Dr. Mack. And okay, there's something. Hey, Betty Goss, thank you for viewing. She says she heard there will be a free testing at the track off of Highway 90, and she'll post an update. Thank you so much, Betty. Appreciate that.
Yeah, let's check on that because Thailand's initially put out a list of times, dates, and sites, and I think that's been redone. So at least some of the places I think have been changed. So just check it. I'm sure you can either go to DHEC's website or Thailand's website to find out about those testing dates.
All right.
And there's a question about getting tested. Certainly if a person has, around a person that has a chronic illness, or if that person themselves have a chronic illness, then it may not be a bad idea to get tested. Again, that a bit of advice that I just gave wasn't always the same way, let's say a month, 6 weeks ago, because there were not as many tests. So again, now that there are more tests, now that you've got people like Thailand's that are taking the lead and that kind of thing, I think if you certainly fall in that category or taking care of somebody who has a chronic illness, it may not be a bad idea to get tested. The hope, though, is that eventually these antibody tests will be accurate enough for physicians to recommend patients get them. And certainly there's studies that are being ongoing to see whether or not having a positive antibody will give you immunity to the COVID. Right now, we think it does, but right now there haven't really been any big studies that say it definitely does. And so once that happens, then I think that will help people out as well.
Okay. We have a couple of questions coming in. Well, question and some information. Just to reiterate, information about the demonstrations that are taking place. There's going to be one rally at the courthouse in Conway, and that one is from 12 to 3 p.m. Today is Friday. Tomorrow, wow. Tomorrow, and voter registration and voting focus. There will also be a march during that 12 to 3 rally. There's also one taking place from 12 to 5 p.m., the Justice Rally, which is going to happen across from Whittemore Park Middle School off of 378. There's a little field that's kind of across from the school, and I guess kind of like at the intersection of 16th Avenue. And there's going to be a number of guest speakers there. And there's also the rally in Georgetown that is happening tomorrow, and that one is going to be from 11 to 2 p.m. East Bay Park at Winyah Auditorium. And there's also going to be a little bit of a march as well with that one. And then on the beach at Market Common on Sunday from 2 to 6 p.m., I believe it is, there's going to be the Peaceful Protesters rally, which will take place at that site. So thank you, Monty, for visiting or for viewing.
I do want to say one more thing. There's actually been about 13 more deaths in South Carolina today.
And Tabitha Dozier Thomas and Tito from Charleston, thank you so much. Yeah, she posted that there's 447 new cases of COVID reported by the CDC today.
Yeah, so there's been one more death in Horry County today.
Wow.
And the number of cases in Horry County has gone up 30 in Horry County today. So 30 more cases, one more death in Horry County. In South Carolina, there's been 13 more deaths in South Carolina today. Yeah. And Georgetown had 3 more positive cases today.
Why do you know, over the course of these weeks, we've noticed that Georgetown's, I don't think their case and death rate has been as robust as Horry County. Why do you think that is?
Well, because of Tidelands and because of Santee St. James. Santee St. James got more tests and Tidelands got more tests. So
Interesting.
they're testing more people. Now,
Okay.
still again, I think that number's still low. Horry County with 536 cases and Georgetown only 82 cases. I don't believe it's that much discrepancy between the two counties being that close, but I still think there's people that just still need to be tested and more testing that needs to be done. And I think that's why Thailand's are taking the lead in having more testing dates. If I'm not mistaken, they probably got about 7 more testing dates between now and the next maybe 4 or 5 weeks.
Okay.
Yeah, but I think that's the main reason. You just got more testing in those areas, but more testing needs to be done.
Right. Closer to treatment, vaccine. Any updates
Well,
on that?
well, that's what I hear. I mean, again, once these, vaccines go into phase trials, phase 1, maybe 30, 40 people, phase 2 hundreds, phase 3 thousands of people. They have to show that the vaccines are statistically significant. In other words, they're taking care of patients, and it's looking at the number of those cases go up versus the number of patients who didn't get a vaccine. So again, that's why it typically takes vaccines decades, to really get it out there because of the number of studies that need to be done and the number of people that need to be in studies. They're fast tracking these vaccines because of the number of cases, deaths, and for fear of not knowing what fall and winter are going to be. I think probably, there's talk maybe by the end of the year, first of next year, vaccines being out. I know there's at least 10 different vaccines that are in phase 2 trials where they've got hundreds of people in the test. So that's one thing. We do know that the convalescent plasma, I talked about that about a month ago when it first started coming out. The people who had COVID, after they recovered, you take their plasma, which is the liquid part of the blood that has the protein antibodies in it, and you give it to a sick person. That's been successful in patients who have been getting that. The remdesivir was an antiviral for people that have been really sick. That's been helping. Again, that's not for everybody, but it has been shown to be effective in the people that were the most sick people.
And Doc, you talked about the fast tracking. I mean, how dangerous can that be to fast track these tests, especially since they typically take a couple of years to develop?
That's $100,000 question, and that's very, very a very legitimate question, and that's why there's some physicians, some people that feel like these vaccines shouldn't be fast tracked, or at least not as fast. And then there's some others that are saying, look, we need to get something out there. So for me to answer that question, I'd have to see studies. I have to see how many people were in the studies. You want to know if there are any adverse reactions that happen with people in the studies. If so, what percentage of people had adverse reactions? So that's a very good question, but it's one of those things where you have to kind of look at a study and kind of know what to look at to make sure that the design of the study is appropriate.
Okay. All right. Well, Doc, I think that we have definitely disseminated a lot of information today, and we definitely thank everyone who took the time to watch today. Once again on Friday, you could have been anywhere, but we do appreciate you being with us. We're trying to just give you the information and updates, and if there's anything that you would like for us to research in terms of topics related to the coronavirus, or even any topics that could, I guess, kind of align with what we're talking about. For example, last week, I believe it was, we had the lawyer from Atlanta who talked about business liability and what businesses are up against as they start to bring employees back to work. And we kind of melded the talk about, or the discussion about sports into that, as, like you said, these athletes start to go back to school or go back to their rec leagues. So if there's something that you're concerned about or you're kind of curious about, just, inbox me or, drop me a post on my page, and I'll get with Dr. Mack and we'll figure it out. We'll bring some information to you. So again, thank you all so much. We really do appreciate it. And we certainly look forward to seeing you next week.
Yes.
God willing, the creek don't rise. We'll
right.
be here
Take
next
care.
week.
Take
All
care.
right. Thank you. Take care.
Bye.